we'll have a guest talk by Dr. Salumon Sekharan from CAHO. Dr. Salumon Sekharan has over 30 years of healthcare experience and currently serves as the Operations and Quality Specialist at Emirates Health Services in the United Arab Emirates. He is also a lead auditor for 3 ISO standards and a passionate trainer and speaker with expertise in accreditation and compliance, risk management, disaster management, and health and safety in healthcare. He has held significant roles serving as the Vice Chair of the Disaster Preparedness Committee and the Health and Safety Committee for more than 10 years. So we'll be talking about benefits of accreditation in healthcare. So I welcome you onto stage.
Hello, good morning. Good morning, everyone. Thank you, AIOTA, and thank you, CAHO, for giving me this opportunity. It's an honor being here in my native place in India, Kerala. How many of you watched the movie Donkey, the Shah Rukh Khan star movie? Oh, I can see many hands there. Some of you are raising your hand half. Why you watched half of the movie, only till the interval? Raise your hand if you watched the movie. Good, excellent. Okay, so before you started or before you made your plans to watch this movie, did you do some research? Did you look at some feedback? Did you look at some online reviews to see whether this movie is worth watching? Yes? Yes, most of us do this. Before you watch a movie or before you make your plans to watch a movie or before you book a hotel or book a holiday destination, you do some research, you obtain some feedbacks to see that whatever you're planning is worth it. Right? Yes or no? All of us do this, right? Okay. What about choosing a hospital? How do you choose a hospital? Google review? Okay. Yeah. Sorry? Patient reviews, yeah, excellent. Now the thing is, with the complexities involved in a hospital's processes, you may not actually rely on somebody's opinion, particularly if you think that person is not an expert in that field. So you will always look for somebody or an organization that has some process or the programs or the standards that tells you, oh, guys, I have this standard and I have assessed this organization and I can guarantee or I certify that so-and-so hospital will provide you reasonably good care, quality care. Is this what we do? So that is where the role of accreditation comes in. Okay? So what is accreditation? Excuse me? Okay. So accreditation is a process in which an independent entity, separate and distinct from the hospital, usually but not limited to a non-governmental, not necessarily non-governmental, assess the hospital to determine if it meets a set of requirements designed to improve the quality of healthcare being rendered by the organization. So look at the key points here. They are independent bodies, they are separate and distinct, and they assess the hospital to determine if it meets set of requirements that they designed. Okay, so that's what accreditation is all about. Excuse me, this is not working, it seems. Could you please? Okay, yeah, it works now. Thank you. So these are some of the popular accreditation bodies across the globe. We have National Accreditation Bureau for Hospitals, the Joint Commission, the Commission on Accreditation of Rehabilitation Facilities, CAP, College of American Pathologists, National Accreditation Bureau for Laboratories, ACR, CHAP and CAMS. There are so many accreditation bodies in the world. Okay, so what does these accreditation bodies do? Let's have a look at the process or the steps involved in accreditation. So the first step is you contact the accreditation body, obtain the standards and guidelines. Then you conduct a gap analysis or self-evaluation to see where you stand in comparison to the standard that they gave you. Then you implement, you conduct your gap analysis, you develop the action plan, and then you implement the plans. You develop your plans, your PPGs, your modified, your electronic medical records, or whatever records to ensure that you have sufficient evidences. And then you monitor monitor and measure how you are performing. You develop your KPIs, you check your KPIs, you have ongoing monitoring, you conduct inspections, tracers, etc. And then you will conduct a mock survey prior to the actual survey to see if everything is okay in place. And then you will also conduct an on-site survey by the accreditation body, and you will submit your systematic improvement plan or the quality improvement plan within a few months. And some of the accreditation bodies like CARF, they expect you to submit an annual conformance to quality report or AQCR on an annual basis. So this is generally what is involved in an accreditation program. So what are the benefits of accreditation? First of all, quality improvement. Quality improvement or continuous quality improvement, as you know, this is the cornerstone of any accreditation program. As I mentioned earlier, all the accreditation bodies have the standards and some measurable elements that tells you what to look for. So you will develop your PPGs, your plans, and your programs, your SOPs to comply with those plans. You will implement them. You will develop your KPIs, your key performance indicators, to ensure that you are monitoring your high risk, high volume, or the areas that you need to monitor to ensure that you are actually you're continuously improving. I can tell you some of my experiences, actually, share with you my experience. When we started with the Joint Commission accreditation way back in 2009 in my previous organization, in the safety department, for example, we had only 2 plans in the safety department. We had a fire safety plan, and then we had an emergency plan that talks about some of the codes. You have a code red and code other, some other codes plan. But when we obtained the standard and we developed our plans, we had to make 11 plans in that safety area. It's alone. We had to develop the safety, security, hazmat, fire, disaster, equipment plan, utility plan, risk assessment and risk management plan, so on and so forth. So we had to make around 11 plans. And we didn't know about this. This was something new for us. Okay, so accreditation definitely tells you that there is, it tells you something that you don't know. So that is the first thing. When we went for CARF survey, actually, I'm leading the program, leading implementation of CARF, Commission on Accreditation in Rehabilitation Facilities, for all 17 hospitals under the Ministry of Health in UAE. I'm the chair of that program. So before we implemented this program, we visited a few accredited bodies. For example, we visited the DPRC, Dubai Physiotherapy and Rehabilitation Center. It was amazing to see how the interdisciplinary team that includes the physiotherapist, the occupational therapist, speech therapist, clinical psychologist, orthotist and prosthetist, how they all work together and develop plans to ensure that the rehabilitation potential of the patient is fully tapped. Okay, they don't see the patient as a patient who seeks cure for a condition. They see this person as a person, as an individual with the dreams and ambitions. So if that person with disabilities want to become a Paralympian, this whole team will work together to ensure that his dream is achieved. So this was something really new for us. So in accreditation, you always learn something new. So you always have quality improvement is an integral part of accreditation. Patient safety, again, all accreditation standards in healthcare have something about patient safety. And in patient safety, you will measure your patient safety culture, and all in one or the other way, they all talk about some patient safety goals. For example, international patient safety goals, how you identify your patient. You won't use the room number as a patient identifier. You will use the MR and the electronic medical, the number, medical record number, or the date of birth. You will have a lot of procedures for prevention of errors, prevention of fall, and so on and so forth. So the benefits of accreditation, particularly in relation to patient safety, are again countless. Staff competence, this is another very important area. All accreditation programs mandates that you have ongoing education for your staff. You have education program and training program for your new arrivals, education program for your existing staff on an annual basis. So the staff competency is a very important factor at the benefit of accreditation. Risk management. Risk management, again, all the accreditation bodies in healthcare talk about proactive and reactive risk management. Reactive risk management, as you know, is something that happens after an incident occurs, and proactive is something that happens before an incident occurs. I have a small question for you here. On the first day of a 3 days accreditation survey in your hospital, the surveyor identifies that your hazardous material area or your hazmat was stored inappropriately. There was no inventory, there was no MSDS, and there was no eyewash. You, as the manager of rehab department, fixed the issue the same day and provided photo and video evidences to the surveyor. The surveyor visits the site again to confirm. The surveyor says, "Well done, and thank you for fixing the concern immediately." Should the surveyor score it met or not met? This is my question. What is your answer? Should this be a met or not met standard? Because you fixed the issue. There was a concern, okay, and surveyor pointed out, you fixed it. This is met or not met? How many of you say met? Raise your hand. Met? 1, 2, 3. Oh, many of you. Okay. All of you are absolutely wrong. Why you are wrong? I'll tell you. Have you heard about this? Correction, corrective action, and preventive action? What you have done was the correction. Okay, you fixed the issue in your hazmat storage area, but that was a correction. You fixed the issue. But there are actually corrective action to prevent a recurrence. Maybe you have other areas where you have the similar problem, but you didn't fix that. You just fixed one issue. You might have the same challenge in other areas. Yes or no? So preventive action is something that happens before. Okay, so preventive action to prevent an occurrence, corrective action to prevent a recurrence, and correction to fix. Okay, so this is the difference. So who is actually responsible? There are 3 lines of defense in risk management. What are those, or who are these 3 lines? First line of defense is the process owner. You are the in charge of the rehabilitation unit, or you are the in charge of laboratory, or you are the in charge of radiology. You are the primary person, you are the process owner to identify the issues, identify the risks in your area, and fix them. The second line of defense are the people who oversee the program. Who are those second line of defense? Maybe your infection control team, your safety team, or the quality team. They are the people who oversee the program. Okay, so if you miss it, they should catch. The second line of defense should catch. If they also miss it, we have a third line of defense. And who are this third line of defense? Third line of defense are the internal auditors. Your internal auditors, your accreditation bodies, okay, your regulators. So they will identify. And this is how we ensure that the process owner, the people who oversee, and the external bodies, they all work together to ensure that our patients are in safe hands. Coming back to the benefits, standardization. Again, as I mentioned, you will not use patient room number as a patient identifier. If that is your standard, you will apply it across the board. I was talking to one of my friends who is a Joint Commission surveyor, Krish, and Krish told me that he was surveying some hospitals in Indonesia, and the CEO, I mean, they had around 25 hospitals. The CEO had 25 hospitals under him, but only 4 of them had accreditation, Joint Commission accreditation. But what he did is, he applied the same standards to all other 21 hospitals. Isn't it great? So standardization is something that is part and parcel of accreditation. Improved outcome. All these that we mentioned, it contributes to the improved outcome. For example, in CARF, Commission on Accreditation of Rehabilitation Facilities, there is person-centered philosophy. So person-centered, what is person-centered philosophy? In the person-centered philosophy, you identify that person, the patient, as an expert in himself or herself. You, the occupational therapist, or the speech therapist, or the physiotherapist, deal with that patient for 1 hour in a day, 1 or 2 hours in a day. You are managing that patient for 1 or 2 hours in a day. But that patient manages himself or herself for the remaining 22 hours or 23 hours. So he is an expert in himself. Okay, so you give that value, that importance to that person, and ensure that the outcome is based on consultation and the inputs from the person served. Helps in regulatory compliance. Most of the accreditation bodies, the standards are robust. They are world-class standards based on the recent literature, based on industry best practices, and they actually exceed the expectations of most of the regulators. So it helps you in regulatory compliance inadvertently. Credibility and trust, the people will trust you, the patients will trust you, the stakeholders will trust you, the insurance companies will trust you. And there is a global recognition, so it will help you in your tourism, medical tourism and other areas. So these are some of the benefits of accreditation. And in addition, it also helps you in the factors affecting implementation of accreditation. These are some of the factors from the literature that affects any accreditation. Senior management commitment. The senior management needs to be seen, they need to talk, they need to walk their talk, their audio, whatever they are preaching, need to be connected to their video. They need to set up and help in serving the committees. They need to set up committees, they need to serve in committees, they need to be visible. So there are many, the management commitment is an important factor affecting accreditation, and accreditation helps in gaining that senior management commitment. Training and awareness, as I mentioned, there are training and benefit, training and awareness. Sure. Training, this is my last slide, thank you. So training and awareness, another very important factor. Communication consultation, effective enforcement scheme, realistic KPIs, availability of resources. I can tell you one example. In my organization, I work in the headquarters of Ministry of Health in UAE. And we have 17 hospitals, as I mentioned. We wanted occupational therapists, for example. And with this accreditation, we were able to recruit. Actually, we are interviewing now. We just completed the interview. We got 7 occupational therapists. We have been asking for long, but with the accreditation, we got seven occupational therapists now. So that is actually the benefit. So you get all the resources. Organizational culture and resistance to change, cost, time, etc. So these are some of the factors affecting, and the accreditation helps with all of them. Thank you very much for listening, and that's all from me.
I would like to invite Dr. S.K. Meena to please come felicitate the speaker, and then we will move on with the next scientific session.